Doctors, which patient lacked complete common sense? Story 1. I'm a vet. A few years ago, I had a client bring his young cat in complaining of lethargy. Besides being a bit underweight, the physical exam was unremarkable, so I asked more questions about the cat's diet. Me. What do you feed the cat? Owner. Online trendy raw food brand? Me. How's his appetite? Does he finish what you feed him? Owner. Yes, he always eats everything. Me. How much do you feed him? Owner. Half a cup. Me. Once or twice daily. Owner. Once every 3 to 4 days. Me. You only feed your cat twice a week? Owner. I believe in a more natural feeding approach, and based on my research, that's how often cats eat in the wild. This owner was slowly starving his cat to death based on some cockamamie idea that he'd made up by watching National Geographic. I had to explain to him that domestic cats are not tigers and that small wild cats eat 10 to 20 small meals daily. Surprise, surprise, the cat's lethargy and weight improved with regular feeding. Oh god, my cat suddenly stopped eating the cat food brand he's been eating with no issues for a year. I spent a ton of money to find out he just suddenly stopped liking it, but I'm happy he started eating. This dumbass in the meantime, some people, My cat stopped eating the brand of tinfoil packet wet food she had been preferring her whole life long. Took her to the vet and no issues were found. A few days later, she laid half a mouse next to her uneaten food as a method of protest. I would rather eat the butt half of this mouse than eat this crap. This was quite the statement on her behalf because she was normally too lazy to be a mouser. A day after that, news ricocheted around the world that the Chinese cat food brand manufacturers had started adding some sort of poisonous material to that exact brand in order to boost protein content, and many cats had died after eating it. I got a refund on my poisoned cat food and switched to a different brand, happy that she had enough sense to avoid the tainted meals, and pleased that she was able to communicate that to me. She lived to be 21 years old and always had food delivered the moment she asked for it. This is an excellent example of why discovering a fact doesn't mean you have the expertise to understand it in context. Story 2. I'm in the ER. So many stories. The one that left me dumbfounded was a woman who was brought in by her sister for pelvic cramps, amenorrhea for 3 months. Lo and behold, she's pregnant. Sister informs me that she sleeps with the Brazilian construction workers building the condo complex next door. I ask if they have any questions. The patient asked me if her baby would come out speaking Spanish. After a long pause and her sister staring at the ceiling, I told her no, because they speak Portuguese in Brazil. The patient seemed relieved, and the sister hustled her out of the ER before I could discharge her. Reminds me of when we got a new doctor in my clinic. The US, a very nice Indian man from Canada. I had a couple of patients ask me if I thought they would be able to understand him, and my response was, well, they speak mostly English in Canada, so if you understand that, you'll be just fine. Loved putting the older generation in their place at work. The doctor had zero accent and didn't even know his parents' language. This reminds me of something funny. Almost 20 years ago now, I saw David Byrne in concert touring for a solo record. Between songs, he started recounting a story about the next song he would perform, which featured some Latin percussion elements. He was talking about how proud he was of having learned Spanish and would be able to communicate with the musicians he'd hired for recording in the studio, but was dismayed to learn that they were from Brazil. Just at this moment, there is a lull in his story and a guy a few feet from me very loudly says something to the effect of, "But it's the same thing!" Everybody in this concert space heard him. 1,000 heads, including David Byrne, turned to stare at this guy with the dumbest smile on his face. The room is silent for like 4 seconds. David Byrne just has one of those looks, then continues with, well, anyway, doctors genuinely witness the funniest stuff, aside from all the sadness, of course. Story 3. Rural ER doc here. 35-year-old female walks in with right-sided jaw/neck swelling. I think it happened because I ate some meat yesterday and my body is reacting to it. 10 minutes later, oh yeah, and I accidentally swallowed a bee and it stung me in my mouth right before this happened. Sorry, I forgot to mention that. Happened to a friend who was a pediatric critical care nurse in Iowa. One day, she heard a lot of screaming and swearing down the hall and went to see what was going on. A man was going wild, taking swings at everyone and screaming that no one was allowed to go near his daughter. My friend calmed him down enough to find out why he was so upset. The father said, "They want to give my daughter blood, but I don't want no N-word blood." Friend, okay, you do know that blood is blood, right? Father, no, she'll turn black if she's given black blood. Friend, desperate to get that blood transfusion scribbled on a paper, baby X is to receive only white people's blood. Okay, sign here. The dude signed, and they started the blood transfusion just as police arrived to drag the lunatic away. A guy I knew, Chris, had that happen to him. The bee, not the meat. Actually, I think it was a yellow jacket. He was working outside, took a drink of his Coke, and felt something sting him in his throat. He told his boss what had happened and said, "I'm okay right now, but if I start feeling anything, you gotta get me to the hospital." Soon after, he felt his throat start to swell, and off they went. They took him to the ER and pumped him full of Benadryl. He was just lying on the bed with 6 or 8 doctors and nurses surrounding him as another guy was brought in on the other side of the curtain. Chris said he could hear the other guy telling his doctor how he'd gotten injured. He was climbing over a barbed wire fence and slipped. The barb punctured his scrotum, and as he fell, it ripped it completely open. He had a testicle just freely hanging out of his sack. Chris said by the time the Benadryl was beginning to take effect, he looked at all of the medical personnel surrounding him and said, "Y'all, I'm gonna be okay, but you gotta go help that boy." This happens to me sometimes too. I prepare myself to tell the doctor everything, and just moments later I remember I forgot something crucial. Story 4. I used to be a medical oxygen tech, mostly doing in-home work. One guy was in such a high concentration that he would have drawn nearly 0 oxygen from breathing the regular atmosphere. This required 2 heavy-duty machines hooked up in tandem just to keep him barely alive. This was explained ad nauseum to him and his wife with full signed documentation of every conversation. They'd shut one machine off because they decided it was too loud. He'd take his mask off because he decided it was too cold. She would unplug the hose if she decided it was in the way. So on and so on. Literally everything you could think of that would restrict or cut off his oxygen intake. Then they would panic and call our emergency service when he started to have a reaction to no oxygen intake. I lived not even 5 minutes away, right beside our EMS/fire station, and the call would always come to me to fix the machines at random times of the day and night, 3 to 7 days a week. They refused to call 911 because they didn't want to make a scene. This went on for ages, well over 18 months, until he was having trouble sleeping one night and shutting the machines off before going back to bed. It's been years and I still see the wife around town. She always glares at me as if I'm the one who killed him. Boy, I don't miss the 3 a.m. call out because some idiot didn't listen to what I told them. Then you try to tell it to them again over the phone, but no, they want to scream and freak out instead. Just send somebody, just send somebody. Okay, well, instead of listening for 10 seconds and fixing the problem, you get to gasp the suck air like a fish while I get up, crap, shower, shave, brew coffee, grab a Pop-Tart, and then finally stroll outside and get in my truck for the 30 minutes drive out to your trailer. That job permanently damaged my regard for other people and my capacity for empathy, and I don't miss it. Unpleasant truth alert, a whole lot of the broken down, sick, terminally unhealthy people you see in the world got that way because they're incapable of shutting their yaps, listening, and following basic instructions. I'm a nurse, and I used to do the same thing, mostly with track-related issues, but I have set up several oxygen concentrators. I was listening to a family how oxygen concentrators work by extracting oxygen from room air and delivering it to the patient in a more concentrated form. The grown son began demanding that I take the concentrator back because the rest of them needed oxygen too. I had to calm the son down and assure him that there was plenty of oxygen in the home for everyone else, but he was adamant that their home was well insulated and he wasn't having it. I ended up getting the doctor involved. Hard to keep a straight face when presented with arguments like that. Story 5. Had a patient come in for facial burns because he smoked while wearing his oxygen, twice in the same week. I feel this. Had a patient who we helped get access to home oxygen privately because his respiratory specialist wouldn't sign off on it because he wouldn't quit smoking. The patient was very indignant about it because he insisted that he had totally quit smoking for realsies and hadn't smoked for 4 months. Got a call from a nurse in emergency a few weeks after letting me know he had come in with facial burns under similar circumstances. Doctor here, the description always makes it sound like some freak accident that couldn't possibly happen with any notable frequency, but it does. If you smoke on oxygen, the chances of igniting it are very high. We've even had to have security remove people from hospital property because they figure they will smoke with their oxygen tank outside of the ER or main hospital entrance. It's not just a high risk for them, but also a high risk for everyone around them. Some light Googling will reveal tons of times that people have burnt down half of their apartment complex and hurt or killed a lot of other people. An oxygen tank is ironically an IED that you carry around with you to stay alive. When I worked in forensics, one of the saddest scenes I went to was a grandmother who killed herself and her 2 young grandchildren because she refused to stop smoking on oxygen, burned the entire house down. The only survivor was the son and father of the 2 children. Had to jump from the 2nd-story window, broke both of his legs in the fall, and still suffered 2nd-degree and 3rd-degree burns. Okay, that took a really tragic turn. Story 6. Not me, but my wife, who is a vet, had a client who got mad at her because he didn't realize that once he neutered his dog, that he wouldn't be able to breed it. As someone who worked at a vet office, I am completely unsurprised. We once had to explain what smegma was to a very embarrassed owner of a new puppy who brought him in for discharge around his thing. Not to mention the countless people who bring their cats in asking about a lump only to be told it's a nipple. And then you occasionally get the inevitable, "But he's a boy," and have to explain that male mammals have nipples too. Like, ma'am, you are married. Have you never noticed your husband has nipples before? I miss working there. I became so paranoid about our puppy after having to put our old dog to sleep that I was at the vet for so many stupid things. Her eyes look droopy. I've heard it might be condition. No, that's just loose puppy skin. She itches a lot. I think she may be allergic to grass. No, dogs just itch. She poops 5 times a day and sometimes it's soft, as would yours if you pooped 5 times a day. It's normal. She has these dots on her nose. What are those? Freckles? Meanwhile, I'm like, that lump on my neck has been there for a few weeks now. Hope it goes away soon. Yeah, there should definitely be a test before you're allowed to adopt a dog. Story 7. This happened in med school on my OBGYN rotation. Patient: who's the baby gonna look like? What do you mean? Well, is it gonna look like the dude who got me pregnant or the guy who's been nutting in me for the last few months? Me, utterly speechless. The baby should look like the people who conceived it. This person is now a parent. This reminded me of the girl who was afraid her drug test would be positive because her boyfriend smoked weed. Me, are you around him getting a lot of secondhand smoke from it? Her, no, you will be just fine then. Her, I was just concerned because we are intimate and I'm on birth control, so we don't use protection. Me realizing what she was asking, he would have to be literally made of weed for you to fail a drug test because of his semen. Child protection worker, it really saddens me the number of teenage girls who genuinely think that the father of their baby is whoever their boyfriend is at the time of birth. Even more shockingly, a lot of teenage boys think that too. I've met several who have signed birth certificates, proud as punch about my son, and then tell me that they met mom 2 or 3 months ago. They think the baby is genetically related to them. How bad does a school system need to be for this to happen? Story 8. Lady brings her baby into the ER with a rectal temp of 103. The kid's patchy as hell and looks like crap. Refuses all medications, says she doesn't believe in them and wonders why her herbal tea, she brought a jug of it, isn't working. Wants us to just check her out. Thinks a children's emergency room just checks them out. Tried to explain why the kid needs an NSAID, keeps refusing. Says she doesn't know what's in it. I bring up the fact she had her kid in a hospital and that she recovered from medication herself, IV, epidural, etc. Doesn't budge. Only concerned for herself. Told her that when the kid has a seizure or goes unresponsive and you call 911, she can expect the medics to give the kid everything it needs regardless of whether you like it or not. Only when the doc threatened to contact social services for child endangerment and abuse did she start to listen, for like 5 whole seconds. Left against medical advice. People like this exist and breed. Medics will do everything they can there and still be stopped if the parent or guardian doesn't want to let them go in the ambulance. Family friends worked together as EMTs, go to a call for an unresponsive infant. They get there and stabilize it. Parents refuse to let them get it to the hospital to get proper diagnosis. They sign the refusal paperwork. The kid died soon after. Parents tried to sue. Neither are EMTs anymore. I don't think that one incident made them leave. Stuff like that just builds up over time. That reminds me of a case in the area where I live. Some wellness-obsessed parents left their toddler's meningitis untreated until the kid coded and died. The parents claimed that the reason why the kid died was because the responding medics didn't have the right size LMA. The parents were warned by friends that the kid was very sick and needed medical intervention, but the parents thought they could treat him with horseradish. Anyways, the last I heard was that the father was doing guest lectures on the wellness circuit. Please tell me they were brought up on murder or manslaughter charges. Story 9. Not me, but my mother would pick up shifts as a nurse sometimes in labor and delivery. and she had met a handful of women who didn't know the baby was going to be coming out of their vaginas. Like, no clue. My mom usually said something like, "How you got it is how it's coming out, honey." This was the late 90s or early 2000s. I'm a social worker, and one of my clients literally kept getting pregnant over and over after having kids. And I had a frank conversation with her about birth control or getting her tubes tied, because she kept going through horrific births only to get her kids taken away. And she actually said to me that she didn't know that birth control or safe sex would save her from getting pregnant. She didn't realize that sex equals pregnancy because she was sexually abused as a child, and her father told her that she could only get pregnant when she was in love, and she had never been in love. So she didn't understand why she kept getting pregnant. Sex was only pleasure for her, so she didn't realize that was what was getting her pregnant. I don't even have words for that. Story 10. Had an 18 or 19-year-old girl come into my ER with some complaint that required an x-ray. It's standard that we do a urine pregnancy test prior to imaging on any female of childbearing years. She insisted she'd never had sex and there was zero possibility of pregnancy. We did the test anyway, and it resulted that she was pregnant. We did a blood pregnancy test to confirm the result, since she insisted she couldn't possibly be pregnant because she'd never had sex. That was positive too. We gave her a few minutes to herself to figure out what the hell happened, and when I returned to check on her a short time later, she asked me if she could even get pregnant because her boyfriend didn't go all the way in. She 100% believed that as long as his penis wasn't entirely in her, it didn't count as sex. It took nearly half an hour of explaining reproduction to her for her to understand whether it was halfway in or all the way in sperm travel. I've got a similar story. I worked in medical records in my 20s, and sometimes I read the reports from the ER or ICU. There was one report from the ER that really perplexed me. A woman came in for some health issues. She said she was sexually active. She hadn't had her period in a while, but she said that there was no way she could be pregnant. The doctors obviously did a pregnancy test and she was pregnant. Now, as a woman, I always know that the moment you have sex, a penis goes inside the vagina, then there is a possibility you could get pregnant. Doesn't matter if you take contraception, there's always a chance. However tiny, that contraception will fail. So I was really perplexed by this patient's vehement belief that she couldn't be pregnant. Apparently women not realizing they're pregnant is really common, and I have to wonder if it's a lack of sex education that's causing this. It's kind of frustrating because I am forced to take pregnancy tests in hospitals when I know this with 100% certainty that I can't be pregnant because my vagina has not been in contact with a penis, and I know why the hospital staff can't trust me when I tell them I'm not pregnant, but I guess I'm just annoyed to be lumped in with uneducated stupid people. I feel like that's more sad than dumb, and it's pretty damn dumb. Story 11. 73 here, former clinical microbiologist, long ago. Still, I found myself all over the clinical lab at times, not just infectious diseases. So one day, this 20-something guy, wife and mom in tow, walks in with a paper request for semen analysis, pre-computer era. Okay, not the most comfortable encounter, but I'm a professional and did this drill many times. He had not been briefed by the doc and had no idea how establishing infertility in males was done. Well, okay, a challenge then. I took him aside and, using standard medical terminology, I told him how a diagnosis is made and what he needed to do to provide a specimen. He couldn't/wouldn't believe that I was asking him to masturbate into that container, astonished. Then he played dumb as if the word was unfamiliar to him. We looped through the medical terms and procedure again, and I eventually resorted to every word I knew to describe the act. It was like a George Carlin bit. A half hour later, he emerged from the toilet with 2 inches of urine in the cup. God almighty. The report went back to patient-provided improper specimen. Oh lord. One of my coworkers was covering a fertility office once and a patient was there to drop off semen and a urine sample. A friend asked if he needed a cup for his urine and the guy said, "Nah, I have one." A few minutes later, the nurse opened the cabinet and looked at my friend and said, The patient left his urine in the same cup as the semen. Oh my god. So my best friend worked as a receptionist in a urologist's office, which sends out their semen tests. This particular patient wasn't having it. He was going to make her take his sample. He demanded she take it. He had worked hard filling it. She was confused. Filling it? Dude, one had a urine cup, not a semen cup, which is smaller and thinner. But when you give a sample, it's a single sample. This man filled the entire urine cup, so he was really mad she wasn't taking it. He kept shoving it towards her on the counter. Then it happened. It spilled. His sample went all over her screen, keyboard, and mouse. He then yelled at her, "Now look what you made me do." Everything about this sounds like a comedy sketch. Story 12. Optometrist here. The patient booked in for an emergency appointment with a raging red eye, clearly very painful. Look under the microscope and the cornea is not really happy. Wobbly reflexes, haziness, the works. Me. What happened? Patient. It's my niece's wedding this Saturday and I wanted to tint my eyelashes to match my hair and the color scheme of the wedding, light blue, so I used the same dye for both to match the color. Me. Does that hair dye contain ammonia by any chance? Patient. I think so. Do you think my eye will be better by Saturday? Will it match the color scheme? Me. Unless you can convince them to change the color scheme to red, no. And that's not all. This reminded me of another story. The patient attends a routine test complaining of gradually reduced vision, which turns out to be due to a cataract. My colleague offers a referral for surgery. No need, exclaims the patient. I know what I need for this. I have lapis lazuli at home. 6 weeks later, came back for the referral. And then there was another story. The elderly patient attends with concerned family members because the patient ran over a pop-up tent on the side of the road that the telephone engineers used to protect themselves from the rain. Luckily, no one was hurt as the worker was on lunch. Worried as to how the elderly driver missed seeing a large red and white tent in the middle of the day. It was then that the elderly relative admitted to having spent the last 3 years driving from memory. A coworker was so proud of how well her 90-year-old husband drove. I just have to tell him where to go. Yeah, that was not to the tune of let's drive to the supermarket and he'd manage. More like right over there. No, a bit further. No, that's a driveway. One further. Now more right. No, that's the curb. For extra dumb points, she has a license and drove regularly when on her own, but can't ruin a man's pride and chauffeur him. Heaven forbid. When I had my driver's license renewed, this included a routine physical, and my eyesight was tested with it and without my glasses on. With the glasses, it was 20/20. Without it, it was 0/20. My doctor informed me that this would result in a code in my driver's license, meaning I wouldn't be allowed to drive without my glasses or contacts. I assured him that this was merely a formality as I would never be able to find the car without my glasses on. Story 13. Plenty, although the one that always sticks in my mind is a patient I met during my early years in a palliative care ward suffering from terminal cancer. She was only in her early 30s, and the only reason she had gotten so far gone was that she had relied on the healing power of crystals rather than, you know, chemotherapy. I always think of the scene in Man on the Moon when Jim Carrey tries basically everything to cure his cancer even though he knows it is fake just so that he can have some hope of survival. I hope to never have to deal with cancer like that, knowing that really there isn't anything that can be done with terminal cancer other than to prolong the suffering a bit. Years ago, I rented a room from a woman whose close friend had terminal cancer but was trying everything to buy more time. She spent a lot of time at the house, and she had some weird electrical device she carried around that was supposed to do something. I had the place to myself for a month because they went to Brazil to see John of God. That dude was just like the charlatan in Man on the Moon. I know those people took advantage of her, and took her money. She was wealthy, and she could afford it. That doesn't make it okay, but it lessens the sadness of it. In her situation, because spending that money didn't take away from her lifestyle, etc., buying into that BS was kind of a good thing. I don't know. I've never had a diagnosis like that, but the way I look at it is that she spent that money to buy hope. It was a false hope, but if that made the end of her life easier, then that's okay. Her family and friends knew it wasn't going to work, but how do you take away someone's hope? I think she was the exception in that kind of scenario. Most people don't have money to waste, and what these grifters do is criminal. But I'm not one to judge a person that takes that route. I think I'd buy hope if I could too. And now John of God is in prison, multiple SA accusations. Story 14. EMS here had a diabetic in his 30s and 40s who refused to take insulin since 2012. It was 2020 at the time when I took his blood sugar and was only read as high, meaning it was over 700 for the glucometer to not read it. Upon seeing this, he asked me if that was high and then went, "Is this because of all that ice cream I ate?" Played a Facebook Messenger video with his girlfriend the entire time. Met him later in the parking lot after he got discharged, and it took this man less than 50 paces from the ER door to rip off the bandage covering his IV and play with the IV wound until it started bleeding all over the place again. Knocked on our ambulance door and asked for a band-aid to fix it. We had to walk him back into the ER and bandaged his entire arm with gauze so that hopefully by the time he got it off, it would have clotted enough for him to not end up exsanguinating himself. I had a guy once stop me to ask me a question. Young, early 20s, 20s tells me he is diabetic, but he doesn't ever check his sugar or anything, and I have a weird tingly feeling in my feet. Is that a big deal? Yes it is. How can you not know that despite being diabetic? That's insane. Story 15. Not a personal experience, but one from a colleague of mine. I only saw the pics. So this 60-something-year-old suffers from an acute complication and gets a pacemaker to solve the problem. Everything goes normally and as planned. He recovers, every care and meds that he needs to take are prescribed and explained, and appointments with a cardiologist are scheduled so that he may get the follow-up he needs. The man then proceeds to never show up to any appointment and never answer any calls from the hospital to know of him and reschedule. This went on for around 3 years until he shows up without prior warning and asks to talk with a doctor that did the procedure to put in his pacemaker. People are weirded out, but seeing that on this day the doctor was present and this patient was in clear distress, they talk to him and manage a couple of minutes to have the doctor check on him. Inside the appointment room, the doctor takes notice that this man is wearing a bra inside of his shirt. The man explains that he has been wearing his daughter's bra for 3 months after his problem got worse. The shirt is asked to be taken off, and there he stands, the shirtless man wearing his daughter's bra, showing off the pacemaker that should have been kept inside of his body, dangling outside of it, being held by the left bra cup, with a big infected open wound above it, with the pacemaker lead still inserted onto his veins and connected to his heart. Nobody has any idea how the man let that situation come to be, or how he didn't die of sepsis or any other health problem that may appear for that matter. I hope he lived. My mom was a trauma nurse and she told me this story that I'll never forget. She said the police bring in this homeless woman with a completely unknown wound to her upper left thigh. It would remain unknown as it was so far gone that there was no way to tell what originally happened. There was a gash as wide as the entire front half of her thigh, and so deep only a thin layer of connective tissue was covering the bone. All of this, though, was determined in autopsy. Why? Because the entire mess was alive with maggots. It was nearly impossible to determine anything until it was properly cleaned. However, fun fact about maggots, they only eat necrotic flesh. Once they flushed the wound a few times, she almost immediately went into septic shock and within an hour was dead. The maggots were the only thing keeping this massive infection in check, and once removed, the infection spread rapidly through the already extremely weakened body and she died. My uncle, who was a massive cocaine addict, got a tooth abscess and decided to treat it by rubbing massive amounts of cocaine on it. Passed out in the grocery store at 1 a.m. The infection had traveled from his mouth to his chest. The way it was explained to me, they pretty much had to crack open his chest, handle all of his organs individually and clean them. Had a less than 10% chance of survival. Made it with limited brain functions. I sure hope he lived. Infections are no joke. Story 16. I don't know if cleaning in a hospital counts, but this one time I got to work early on a Saturday morning and we immediately received a request for help from the ER and got sent over by my boss. When I got there, the first thing I heard was yelling from this guy behind one of the curtains. He was shouting at the nurses, "Don't touch my penis!" and "I didn't use any drugs." Then I smelled iron in the air, and then I found out there was blood all over the hallway, handprints in blood against the wall. Almost the entire floor was covered in blood, with actual puddles in some places. What happened? The guy pulled out his catheter, causing arterial bleeding, and decided to run away from the nurses who were trying to help him. It seems like he lived through that. I never saw that much blood before that day or after. I had a hernia and subsequently had surgery for it. It was supposed to be an outpatient surgery to put in a mesh with me going home the same day. When I awoke after the surgery, a nurse spoke a sentence to me you don't want to hear when you wake up after surgery. There were some complications. The catheter had got caught in my urethra, and in the process of dislodging it, there was a little damage. I was told that my first bladder movement would be painful and bloody, but each subsequent one would be less so. They kept me overnight for observation. The first time I did pee afterward, it was the color of a deep red wine and excruciatingly painful, possibly the worst pain I've ever experienced. I was fine after a day or two. When the doctors say they screwed up like that, that's when I announced that they are giving me the prescription for the good opiates. Thanks for watching until the end. If you have a similar story that you would like to share with us, please leave it in the comments below. If you enjoyed this video, please give us a like and make sure to subscribe. For more videos like this one right now, please stop by our channel. Thanks again and see you next time.